Thank you, Alicia. Hi, everyone. I'm Jenny Zhang. I'm a senior researcher at the American Institutes for Research, and I'm very pleased to be here and to be able to present our work with you all here today. I'd like to quickly give a shout out to our project team members here today. We have our PI, Kirsten LaFlock, Christy Zeiser, Iris Darawala, Jingtong Pan, Maura Shramko, Stephanie Levin, and we're also thrilled that our ISB partners are here today, Sarah Luttrell and Tiffany Burnett, and you'll be hearing from them in just a few short slides. So I think if we go to the next slide. So we have a very similar format as the first session presenters. We'll share a little reminder of what our study is. And we'll share today findings from our implementation study, our student and staff SEL well-being survey results, and findings from on participation and uptake on the 3 SEL interventions that we're studying. And then we'll talk a little bit about what Illinois is planning and prioritizing in terms of SEL for the future. I think if we go to the next slide, I'm going to hand it off to Sarah here.
Hello, everyone. Thank you for having us. I'm going to go ahead and give you a little bit of a background about our work. Illinois prioritized social emotional learning and well-being supports for students and staff as part of the COVID-19 pandemic recovery efforts, and it's still ongoing. Our statewide SEL approaches were flexible, localized, and they delivered SEL supports and resources to meet school and district's needs. The Illinois Renewal SEL study examines changes in student and teacher outcomes associated with our SEL programs and the implementation and costs of SEL-focused pandemic recovery programs. We can go to the next slide. So you can see on the right-hand side, our map in Illinois is divided into 6 areas, including Chicago Public Schools. And these areas each house an Illinois SEL, social emotional learning hub. The hubs are responsible for delivering professional development that is localized, and it's highly focused on SEL. The SEL hubs also have established and expanded SEL programming, including trauma responsiveness, school mental health, equity, and staff well-being, starting with the pandemic, and it's still ongoing. We've also partnered with REACH. REACH is resilience education to advance community healing. And REACH offers additional supports to schools by engaging in a systemic approach to trauma responsiveness through an online app. Schools are asked to form a team. Then they conduct a short needs assessment in our Illinois State Board of Education system. And then from there, they develop and carry out an action plan that is developed and carried out with an SEL hub coach. We also have a community partnership grants that support this work. The grants integrate local community supports as well as mental health and trauma responsive practices.
Thanks so much, Sarah.
Thank you.
So our research practice partnership with ISB, with Illinois, it includes 3 studies, or 3 key components. We've got an implementation study where you're going to hear some of our findings today that focused on a state landscape analysis to understand, how were these programs implemented across the state. We also conducted case study interviews with 12 districts and schools to really understand in depth how they were implemented within schools. Today, we'll be sharing one of our key findings about the main facilitators and barriers to implementing and sustaining these Illinois SEL activities. We also have an outcome study where we're seeking to understand the effect of these SEL programs. We're exploring those relationships between student and teacher social emotional outcomes. Ultimately, we are still working, so just a little bit of a caveat is that today we are not quite there in our study to present these outcomes findings. We're working on them, but we'll be focused on uptake and participation. So just wanted to put that out there. When we also have We don't have time today, but we also have a cost study component where we're looking at the cost of implementing these programs. We go to the next slide. Oh, okay, thank you. So what have we learned? In our study, for 3 years, we administered a school staff SEL and well-being survey. And across these 3 years, we see the same pattern. We see that staff overall are reporting pretty positively on their social emotional competencies and well-being. They're reporting high competency in emotional intelligence and SEL practice and their capacity to support students in their school working conditions. What we do see that's lower, and every single year is the same pattern, that there's lower general well-being and professional well-being. We see that, about 46% of staff, they reported feeling burnt out by their work. 40% reported feeling frustrated by their job. So that is something that we've seen in all of our years in the study. We go to the next slide. We also administered a student SEL and well-being study, seeking to really understand how our students are doing. And across similarly, we see the exact same pattern across all 3 years of administration, that they reported lower levels, that they reported pretty high competencies in social awareness, responsible decision-making, relationship skills, but where we see students reporting more difficulty is in these self-management domains. Goal management, schoolwork, emotion regulation. So through our survey, we're seeing that students are aware of their emotions, they have knowledge about them, but they have trouble putting into practice that, emotion regulation, managing their schoolwork, and managing their goals. For example, about half of the students responded that it was difficult or very difficult to stay calm when I feel stressed. About half reported that it's difficult or very difficult to get through something even when I feel frustrated. I think if we go to the next slide, Chrissy, who's going to talk a little bit more about these SEL program participation and uptake.
Thanks, Jenny. Hi, I'm Chrissy Zeiser. I put in the chat, I'm the outcome study lead for this study. And I actually just joined the project earlier this year. So it has been quite the lift to understand these 3 different programs that were all taking place at the same time, as we show on these lovely maps. These were really widespread across the state, and there was a lot of overlap of schools participating in multiple programs. And so these are not like mutually exclusive categories. Schools could opt into whichever programs they thought they may benefit from most. And especially with the SEL hub activities, that third map, this is just, did they participate at least once? There were some schools that participated like 14 times on 14 distinct days in a single school year. So there were definitely levels. There was variation across schools, both in which of the programs they implemented, what combinations of programs, and the intensity of their participation within that program. For the outcome study, I've been trying to disentangle the understanding of which of the schools were participating in the different programs, what were the characteristics of those schools, and then trying to come up with a comparison group of schools that didn't participate in any of the programs. And so as you can see in the red text, there are about 900 schools, which is less than a quarter of schools, public schools statewide, did not participate in any of the 3 programs. So ultimately, across the 3 programs, this was really brought to a high scale across the state, so that it is kind of tricky to disentangle, like what would an impact of the programming be when there could be multiple combinations of programs that schools are participating in, and the majority of schools, both across elementary, middle, and high school, are participating in these programs. I just have one more slide that I was going to present on. So what I'm in the process of doing now is better understanding, looking at the data to understand what are the characteristics of schools at different levels of participation, really focusing in on the SEL hub activities, because there is a whole other report, a whole other study that was done on the REACH schools. And then I'm also going to be looking at the community partnership grants to also look at whether or not schools were listed as receiving services through a community partnership grant. But as I mentioned, for the SEL Hub activities, there could be multiple levels of engagement. In talking with ISB, they mentioned that it was really important that schools have consistent engagement. I think the number of activities that they could participate in may be driven by teacher availability, administrator availability, location, et cetera, but really participating in both years really mattered. So in this graph, everything from engaged up indicates that the schools were engaged for both years. The partially and minimally engaged means they participated in one year, but not the other. And then the not engaged includes those schools that were not participating in any of those activities. And as you can see in this graph, I just really wanted to point out that the rural schools were disproportionately more likely to be highly engaged in these SEL Hub activities when compared with, for example, the city schools. I do need to caveat here that Chicago Public Schools is not included in this figure because there we only know if they participated or not the intensity of participation for those schools. But for the rest of the state, really we saw greater uptake and greater intensity of participation in those rural areas. And on that note, I think I was going to hand it off to Iris, who was leading more of the implementation study aspects of the study.
Thanks, Chrissy. And yes, I'm Iris, and I'm the implementation lead for this study. And with the implementation study, we were trying to understand how implementation of these 3 programs were unfolding across the state, including the key facilitators and barriers to implementing SEL programming. It was super interesting because of how decentralized and flexible everything was. And so we definitely learned a lot through this process. So we asked questions about the motivation for participating in SEL programming, reasons why schools have prioritized certain SEL activities, perceptions of effective activities, and some of the local conditions that supported or undermined participation and implementation in SEL programming, as well as what it takes to sustain these activities after funding ends. So we conducted a series of interviews with regional education and SEL leaders across the state over the course of 3 years, and did a deeper dive into implementation at 12 case study sites over the course of 2 years. So in total, that was 113 state interviews and then 78 case study interviews. And one of the key reasons that we did these in-depth case studies was we wanted to understand the extent to which what we heard from school staff aligned or diverged from what we were hearing from the state level interview participants. And then before we dive into some of the findings for the implementation study, I just wanted to upfront kind of talk about the differences between social emotional learning, SEL, and mental health, because they overlapped in a lot of ways on this study. But when we're talking about SEL programming, we're generally talking more about restorative practices, sort of proactive approaches to regulation, interpersonal conflicts, understanding how the brain works. It has been part of that, like neuroscience, common corners or classroom management things that teachers can try. And when we talk about mental health, we're usually talking about some of the more clinical aspects. So with this green pillar, we can start here. And something notable is that there's a lot of alignment when it came to core issues around regional relationships and support, SEL infrastructure and sustainability between the state and the school level. So with this green column, the state level interview participants talked about the history of the regional offices of education in Illinois and their relationship with districts. They've long been the conduit between the state and schools and have a deep understanding of the local history, the context, and the needs of schools in their regions. And these strong relationships really helped promote SEL in a way that was tailored and flexible and that really honored that local context. And then when we talked to school staff, we again heard that that regional office communication and those relationships supported school leader buy-in because 1, they trusted their regional office because of that history I just talked about. And 2, their regional office point person or coach, sometimes a coach and sometimes another staff member, would work with them closely on understanding their specific needs and then tailoring the types of opportunities available to match those needs to their schools. So these 2 considerations were important because school staff shared that buy-in was a key motivator of SEL PD participation and implementation. So one potential implication here is about the overall policy implementation strategy for learning renewal SEL. So this decentralized, flexible approach to using these regional offices to work with localities and choosing the right SEL opportunities and opting into them may have supported broader buy-in and participation overall. Like Chrissy demonstrated in her slides, there was really broad reach and scale across the state. And in the case of future educational disruptions, this strategy could support a broader reach and uptake for schools across the state. So just to quote one of our interviewees, the regional offices have been around since the Civil War. We've always been here. We always will be. We're not a flash in a pan, like hiring a consultant who works with you for a year. We are going to be here forever. The principals know their regional office. The relationship's already there. It wasn't like somebody showed up that they'd never heard of telling them what to do. The offices that they've known for a decade show up and say, I have a free resource for you. And that kind of encapsulates what we found related to those offices. And so if you could go to the next slide, please. So moving along to this gray column, at the state level, participants talked about the importance of these SEL hubs, which were these kind of regional SEL warehouses. They were housed within one of the regional offices of education in an area of the state. And they connected the regional offices of education with resources and guidance. And so they were sort of this connective tissue between regions, fostering opportunities for regular convenings, discussion, and ways to identify speakers, programs, or events that worked well in their regions and could be adapted in others. So for example, if one region found a series on neuroscience compelling, they would share it with others whose schools or districts identified that as an area of growth, and then they would coordinate and troubleshoot the best way to approach implementing that training. And then at the school level in our interviews, staff talked about the importance of their SEL or Regional Office of Education coach and the support that they provided specifically related to needs assessments, action plans, coaching, and PD coordination. In some cases, the coaches were even helping find substitutes at schools that needed them in order to have their staff attend SEL PD. So something really important to note here is that staff from rural schools identified their SEL coach as instrumental in helping them find out about SEL opportunities, connecting them with resources in other schools or districts, and stepping in to problem solve a lot of the coordination challenges with professional development. So an implication of these findings is that, without continued funding for the SEL hubs and these coaches, some of the regional offices of education might not be able to retain these coaches, many of whom were funded by the grant. And without coaches, schools might lose momentum or discontinue SEL implementation. So school and district staff also shared that in cases where staff were taking on new responsibilities related to SEL, it was often difficult to juggle, and they leaned on that coach to fill that gap in capacity. And this was especially relevant at small and rural schools where they were already fulfilling multiple roles. So I really want to emphasize here that the inability to fund the salaries of SEL coaches may have a disproportionate impact on rural and small schools, which is significant in that the schools in small towns and rural areas were the ones that tended to be highly engaged in SEL activities, as Chrissy mentioned earlier. So removing that support might pose an equity issue with accessing or continuing SEL programming. So next slide. Okay, so we move to the blue column on the right, one of our main findings from the state level interviews is that schools needed a lot more time to integrate SEL into their own infrastructure. So sometimes it felt like it was a bit half-baked, like they were just beginning to get their bearings, but were not really in a place to make any major shifts to their routines or infrastructure. And that's because a lot of schools were getting exposed to SEL for the first time and understanding what it entailed and focusing on that initial needs assessment and action planning. And then when we talked to school staff about their plans to continue SEL, many of them talked about adopting new strategies to pursue the work. So for PD that was once free, some school leaders talked about shifting to models like a fee-for-service model. But that could potentially pose barriers to, again, small or rural schools that couldn't afford to pay. So a major appeal of these supports to schools was that they were at no cost. So again, the main policy implication of this is that, withdrawing the funding and support could create some inequitable access to SEL resources, especially for those small and rural schools. And if we have time, I just want to take one step back and just talk broadly about how all of this relates to future disruptions in education. From the implementation side of things, there were really three primary considerations that state policymakers might want to consider when crafting both education policies and implementation plans during future disruptions. So one, allowing schools and districts to opt in, and especially to a free resource, was a major selling point of this work. It really created a sense of respect and deference to localities, that they knew what was best for their schools, and that contributed to a sense of trust, which was critical for buy-in, which was a major motivator of participation. It strategically positioned the regional offices of education as a conduit and partner in creating a localized, tailored, and flexible approach to adopting SEL supports, and that engendered more trust between individuals and entities who have had a history of working together, also contributing to buy-in and bolstering motivation to participate. So using these regional offices might be an effective strategy for policy rollout in the future to ensure broad reach and uptake. And then, the SEL Hub infrastructure was really critical for creating connections between offices that didn't exist before, and for forging new cross-organization and cross-regional relationships. So that really supported the breadth and the reach of the initiative. I know I've talked a lot, so I will stop, and I think there are some questions flying around the chat.
Yes, and we will get to the questions, Iris. I just want to make sure you get to the last slide in the presentation that talks about planning for the future, and then we'll open up and I'll facilitate the Q&A.
Great, thank you.
Okay, so I think that this one's me. All right, hi everybody. Thank you so much for having us today. I am Dr. Tiffany Burnett, the Executive Director for Safe and Healthy Climate here at the Illinois State Board of Education. So there are many facets to what the State Board of Education is doing to support staff and student SEL and well-being within our state. The SEL hubs, of course, we've talked about. They have been just a critical resource for our schools and districts. And we are continuing to support that this year, of course, and we want to see that continue and hopefully grow and expand as we continue to do. The hubs also help us to sponsor our wellness conference, which we hold in the spring of every year, which is a phenomenal place for people to come together in person and share ideas and become revitalized during that time. And we also have our RSSI, which is the Resilience Support Schools Illinois, which is the continuation of the REACH program. So the RSSI was launched last year as a pilot. It's a 15-question survey that schools can take, and then they're given a snapshot, and then they're provided the opportunity to choose a pillar to work on for improvement. Self-paced guided modules are housed on the RSSI website for this, and it allows schools to work at their own pace on the things that they consider to be the most important to their continuous improvement process. This year, we are beyond the pilot year. We launched full force to every school in Illinois. This is a absolutely free resource that they're able to participate in. And of course, we have our social emotional learning hubs that continue to support this work. So as well, and assisting our schools and districts that are working through the RSSI process. In addition, what has been big for our state is that we have now legislation which requires universal mental health screenings for students in grades 3 and through 12 in the state of Illinois, at least once per year. This will be fully the full implementation year is the 27-28 school year. The state is required to have a tool that we've procured for schools and districts to be able to use free of charge, for them to be held accountable for ensuring that all students are screened during that 3 through 12 during that 27-28 school year. ISB is currently working on guidance to provide to the field, which will be released on or before September 1st, 2026. So this is a really, really big deal for our state. The fact that, legislation has now been passed that really does support the fact that it's very important for us to ensure as early as we can that our children are receiving all the supports that they need to be successful, whether that be, nutrition, right? That's part of it, but also there's the social, emotional, and the mental and behavioral health aspects as well. So this was really huge. Our state also has a mental health portal, which is called Beacon, uh, that parents can access free of charge in the state. Again, it's open statewide, it's free of charge to help our communities, our families to find resources, mental health resources, because in some of our areas there is a scarcity of those in certain portions of our state. So we want to make sure that we are connecting and providing support to those parents. And once they log into that portal, they are also given support um, from the workers that work that program, which is not the State Board of Education. Um, it is other state partners that work on that, but really just trying to ensure that we are making sure that all of our students in all of our schools have the supports they need to be the best that they can possibly be and reach their full potential. That's it for me.
Thanks so much, Tiffany. So I just wanted to kind of wrap up and say that over the next few months, we will, analyzing our findings, writing them up. We share them on the Restart Network website, so you can find them there. We'll look to Restart to support us to disseminate as well. And in the meanwhile, if there are any questions, you can feel free to email us at our study email here.